You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of minimally invasive facial rejuvenation. With us, we have an expert on the topic, board-certified dermatologist, Dr. Mona Fouad. Dr. Fouad, welcome to the program.
Thank you, Randy. Thank you for having me.
Good. Now, before we get into today's topic, I guess this is a hot topic. Everybody wants to look a little younger. Tell us about your center, Cincinnati Dermatology Center.
Well, we are a dermatology practice, and we do medical, surgical, and cosmetic dermatology. So I see all age ranges. In my medical practice, I have infants all the way up to 90-year-olds.
You have a great background. So let's begin with the aging face. When you look at the aging face, how do you look at it? What do we need to know?
Well, I think the first thing is people come in and they have all these ideas in their head. Oh, this is Botox, this is filler, this is that. And I think they have to understand why their face ages. If you don't understand why your face ages, you're not going to understand what you should have.
I mean, that's important to know?
Oh, absolutely.
Okay.
Oh, sure. Okay. So, for example, the most common cause of the aging face is what? Sun damage. Sun damage, cumulative sun exposure causes brown discoloration, red discoloration, causes loss of collagen and elasticity in the skin. So that's number one.
All right. Okay. So you get people at different levels of damage, right? Certain people are going to you before all of that happens.
Sure.
Some people did because I mean, doesn't everybody use sunblock nowadays on their face at least?
I would say
or are you surprised sometimes?
Yeah, I'd say most women do. Not all men do. I think they're getting a lot better.
And most of the people that are coming into you are women. Are more and more men coming in?
I would say more men are coming in. I definitely have more men that are... No, not more than women.
More than ever before.
But I think more than before. I think men care more now than they used to.
Okay. So with skincare, let's start there and then we'll move into fillers, Botox, and of course all the laser technology.
Sure. So if you have somebody, or I have somebody who comes in and they just want to start simple, because a lot of people say, oh, I don't want to be vain, I don't want to do a lot. Skincare is the easiest place to start because, like I said before, you're going to do it every day anyway.
And it could have a huge impact, though. I mean, is that right?
I think it can have a big impact. And sometimes people just want to look healthier. They want their skin to look healthier. So I think your sunscreen, of course, that's important. Vitamin C, topical vitamin Cs, I think are essential. If you want one thing that's going to make a difference, I would use a topical vitamin C.
Are they all the same? I mean, is this something?
Oh, no. You really have to have a well-formulated vitamin C, and it has to be the L-ascorbic acid. And so we carry SkinCeuticals vitamin C, which I personally think is the best on the market. That's the one I like the most. And it can actually decrease sunburn cells, meaning when you have it on, you're actually decreasing your risk of sun damage while you have it on.
Really?
Yeah. And it then helps build some of the collagen because it's a vitamin C, and it just gives you a healthy glow.
So is that a nighttime, morning?
Morning.
Okay.
You put it on in the morning. You wash your face. So the first thing you want to do is you want to wash. And I recommend gentle chemical exfoliation, using something with a glycolic in it, all right? Or maybe a light salicylic acid, but something to help gently exfoliate the skin. And then you use your vitamin C, and you use your moisturizer with a sunscreen.
So are you making the skin healthier with this?
I would say that you're definitely making it healthier with a vitamin C because you're helping to prevent DNA mutations from sun damage.
All right, all right. Okay, so what's next?
So then I would put your Protect, and your Protect is what most people do anyway, which is a sunscreen with a moisturizer. And then your last step is Treat, and Treat is a really individualized step. You might be somebody who has a lot of fine lines and wrinkles and wants to use a Retin-A or retinoic acid. You might be somebody who has a lot of pigment problems, and so you're going to be either using a fading cream with hydroquinone or perhaps a kojic acid. Now, I am a firm believer if you have pigment issues, you should be using a kojic acid year-round because it's safe in pregnancy, it's safe to use year-round, and it actually suppresses pigment formation. And I usually recommend that you use your hydroquinone or fading cream as a rescue, just to help treat the pigment that's there, usually in the fall and the winter months.
And these are prescription, what you're talking about?
They are prescriptions, or again, they could be cosmeceuticals.
So when a patient comes in on a consult and you look at the face, what's going on in your mind?
I am dividing their face into thirds. I'm looking at the top third, and typically up in that top third, the forehead area, I'm thinking more likely Botox. In the middle third, I'm thinking about the loss of volume that they have in their cheeks and nasolabial folds, and I'm usually thinking fillers. And then in that bottom third of their face, again, depending on what their problems are, I may be thinking again of fillers, maybe Botox, and again all over, you're thinking skincare and maybe laser.
And when the patients come in, what do they want to know? I mean, there must be frequently asked questions that are asked every single time. Do they say, doctor, what do you think I should do?
Oh,
Do they come in
sure.
self-diagnosing? They already know what they need to be done or needs to be done?
Well, that's really patient dependent. Some patients are very savvy, and I think that they're more and more savvy these days because there's so much information out there. And some patients really don't know. And so they come in and they say, what do you think I should do? And my first question back to them is I hand them a mirror and I say, what do you see? What bothers you? Because I might see something that they don't see.
What do they usually say?
Oh, goodness. A lot of times they'll say, I just look so angry all the time. Or they'll look, I'm so tired of these lines around my mouth that are making me look tired.
But the number one thing that makes you look tired is kind of or bags under your eyes a little bit, right? And
I
that
would
frowny
say,
expression?
Yeah, I would say the frown, the sunken look that people tend to get as they kind of get this line, what we call the nasolabial fold, and then these marionette lines that people get over here. Everything seems to pull your face down. And that's what makes people tired. And if you think about it, children have this cute triangular face shape. It's pointing up like this. And all of a sudden what happens is we get older, it goes like that.
Interesting.
So a lot of what we do is trying to reverse that triangle and putting the emphasis back up.
Okay, now Botox, it sounds pretty straightforward.
Mm-hmm.
Is there a lot of technique in Botox?
Well, you have to understand the anatomy. If you don't understand the anatomy, then you're not going to understand how to do Botox. A lot of people come in the first time and they say, I'm really nervous. I'm nervous to do Botox. I don't know why I'm nervous. And I tell them, I was nervous. The first time I did it, I was a little nervous myself. But I said, you know what? I'm going to be doing this. I need to understand how it is, what it feels like. I can explain it better to patients, and it's wonderful.
So what is your goal? I mean, do you want to give them some expression? Is the goal just to flatten out those lines? Because some people like that frozen look, which is not always attractive.
Yeah.
I mean, what are you trying to do? I mean,
I think the most important thing you can do is listen to your patient.
Okay.
You have to ask them, what do you want? And they'll tell you, I don't want to look frozen, or I don't want any lines. So you really have to be listening to what they're telling you. And then you can take it from there. Again, that goes back to what I said. I hand them a mirror and I say, what bothers you? And then they'll say, well, what do you think? And I'll tell them, in a perfect world, this is what I think you need.
Now, with the brows and Botox, I hear you can create a bit of a brow lift. Is that an exaggeration, or that happens? Could happen?
No, actually, if you think about it, again, going back to the anatomy, you know that this right here, what people call those 11s, these are brow depressors. So as you frown, what you're doing is you're depressing your brow. So by blocking that, what do you think you do? You elevate the brow, right?
Okay.
So what about horizontal forehead lines? Well, those are the frontalis muscle, and that is a brow elevator. So if you block that, you might get a little bit of your brow going down. So you have to actually be careful where you inject and who you inject on. You don't really want to inject in somebody who has a really heavy lid, because that'll bring their brow down a little bit.
Okay, under the eyes, filling in the hollowness definitely makes you look tired. But I'm more confused than ever. I have doctors, plastic surgeons, we've talked about this, and they have different opinions. Some people say, Randy, I don't like to use fillers under the eyes. I've talked to other people say the reason they don't like to do it is because they don't know how to do it. They're not good at it. Where do you stand as far as fillers under the eyes?
So what I like to do is I actually take a hyaluronic acid like Juvederm or Restylane, and then I go straight down to the bone and just put little droplets all along the bone there. And you get such a nice dramatic result.
Is it predictable though? That's the scary part. We've talked, I said I'd like to do it, but it seems, I don't want to look puffy.
Well, you have to know the patient that you're going to do it on too, and you again have to look at their anatomy. Not everybody is a candidate.
Is it painful though? Or they're numbed up?
So.
I mean, they don't complain about pain?
They're numb, and they're not, and they're not in pain.
Is this one of those things though? It's instant results. I mean, it happens right there in front of you.
Yes. Well, and that's with all fillers. Fillers are so exciting to do. I love to do fillers, and I love them because it's just returning their youthful look is what you're doing. And they come in, they say, I look tired. And one of the biggest things that I've started doing within the last couple of years are cheeks. And cheeks to fill in this area.
Really?
Gives people a lift. Oh yeah.
So when I'm talking about under the eyes, it's the cheek. The cheek is having the problem.
No, there's
Okay,
there's
different
two
place?
areas. Two areas. Tear trough is right under the eye, but then you've also got what's called the malar fat pad right here, and you're filling this in because what happens again is as we get older, this droops. It causes this fold, causes your jowl.
Okay. Oh.
So, and again, that triangle we talked about before starts turning over. So what you want to do is you want to lift it back up. And by just putting it right here in the cheek, you actually lift this back up. You
Really?
know,
Oh, so that lifts, and sometimes you don't even have to do?
right. Well, people think
Really?
it was so funny. I had a patient just this week, and she's from England, and she said, you know, people are calling it pillow face because they're getting so much filler here and not addressing here that they don't look natural.